In this video, we're going over the exercise, the half kneeling pelvic tilt. This is for patients with hip pain and low back pain caused from sitting at their desk for too long. As we sit for long periods of time, the muscle that's on the front of our spine that goes through the groin to our leg will eventually shorten. As we stand up, two things happen. It takes our spine and pulls it into a hyperlordosis, or an extra curve, and it takes the ball and socket joint and pulls it into the socket up high, causing low back pain right here and achiness in the front of our hip. For this exercise, we're going to be on one knee, and instead of leaning forward to lunge to stretch the hip flexor on the left, we're going to actually sit back on our knee, take our pelvis, squeeze our core, and squeeze our glutes, and rotate the pelvis in a posterior direction. We're going to feel a stretch on the front. I like to continually squeeze the glutes for about 15 to 20 seconds and hold as I constantly think about the muscles in the back squeezing together. So going from a anterior pelvic tilt, scooting backwards, tucking the tail, rotating the pelvis up, and squeezing the glutes together as I'm flexing my core to get a stretch on the left side in the front.